Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Neurologic and psychiatric drugs. As a knowledgeable nurse, you know that you should never give amphetamines in combination with Option A. Oral hypoglycemics. Option B. Oral hypoglycemics. Option C. MAO inhibitors. Option D. Antihypertensives. Right answer is Option C. MAO inhibitors. MAO inhibitors must never be given with drugs affecting the CNS because hypertension can occur. Amphetamines can be given with oral hypoglycemics and insulin as long as blood sugar levels are monitored because these can decrease anti-diabetic requirements. Use of methylphenidate for attention deficit disorders in children can result in Option A. Tourette's syndrome. Option B. Growth suppression. Option C. Growth spurt. Option D. A and B. Right answer is Option D. A and B. Use of Ritalin does not cause a growth spurt. Instead, it can cause Tourette's syndrome and growth suppression in children. Amphetamines and amphetamine-like compounds are most commonly used for Option A. Narcolepsy. Option B. Attention deficit disorder. Option C. Attention deficit disorder. Option D. All of the above. Right answer is Option D. All of the above. The most common uses of amphetamines and amphetamine-like compounds are narcolepsy, exogenous obesity, and attention deficit disorder. When administering for phenytoin, Dilantin, the nurse should Option A. Administer it at a rate 100 mg per minute. Option B. Protect the drug from light exposure. Option C. Mix the drug in dextrose solution. Option D. Mix the drug in saline solution. Right answer is Option D. Mix the drug in saline solution. Phenytoin must be mixed in saline solution only. Phenytoin should be administered at a rate of 50 mg per minute. There is no need to protect phenytoin from light because it does not destabilize with light exposure. Phenytoin will precipitate when mixed with a dextrose solution. When caring for a client who is receiving phenytoin and warfarin, Coumadin, the nurse would expect which of the following drug-drug interactions? Option A. Decreased effectiveness of warfarin. Option B. Increased effectiveness of phenytoin. Option C. Increased effectiveness of warfarin. Option D. Decreased effectiveness of phenytoin. Right answer is Option A. Decreased effectiveness of warfarin. The interaction will reduce the effectiveness of warfarin. The client asks the nurse why he's taking bromocriptine, Parlodel. The nurse's reply is based in the understanding that bromocriptine mimics the effects of dopamine by Option A. Decreasing dopamine levels in the brain. Option B. Decreasing the storage of dopamine peripherally. Option C. Activating dopamine receptors in the brain. Option D. Inhibiting monoamine oxidase type B. Right answer is Option C. Activating dopamine receptors in the brain. Bromocriptine is a dopaminergic agent, and this response refers to its action. Choice A refers to the action of levodopa. Choice B refers to the action of carbidopa and levodopa. Choice D refers to the action of selegiline. Before administering amantadine, Symadine, the nurse should investigate which of the following client statements. Option A. My hands are always shaking. Option B. I had to take Dilantin 6 months ago. Option C. I take low-dose enteric aspirin each day. Option D. Simple tasks seem to take so long to perform. Right answer is Option B. I had to take Dilantin 6 months ago. Amantadine is used cautiously in clients with a history of seizures. A and D are clinical manifestations of Parkinson's disease. Amantadine does not interact negatively with aspirin. The priority nursing intervention for a client receiving amantadine is to teach the client to: Option A. Monitor the pulse for rate and regularity. Option B. Take the last dose of medication at bedtime. Option C. Inspect the skin for erythematous rash. Option D. Stop taking the drug if the mouth becomes dry. Right answer is Option A. Monitor the pulse for rate and regularity. Dopaminergic agents can cause heart rate changes and cardiac arrhythmias. Choice B is incorrect because amantadine can cause insomnia. Choice C is incorrect because an adverse effect of amantadine is a mottled discoloration of the skin. Choice D is incorrect because dry mouth is an expected side effect and not an indication to discontinue amantadine. Which of the following assessment is most essential before beginning a drug regimen of an antimuscarinic agent? Option A. Date of birth. Option B. Ethnic background. Option C. History of diabetes. Option D. Activity intolerance. Right answer is Option A. Date of birth. Antimuscarinic agents are contraindicated in elderly patients. The nurse evaluates that carbidopa and levodopa, Sinemet, is therapeutically effective if the client has: Option A. Decreased GI responses. Option B. Increased tolerance to pyridoxine. Option C. Decreased tremors at rest. Option D. Increased urinary output. Right answer is Option C. Decreased tremors at rest. Carbidopa and levodopa help restore the balance between dopamine and acetylcholine, thereby controlling the responses of Parkinson's disease. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.